All right, we're going to start. My name is Dr. Kerrin Begg. I'm the Deputy Dean of Health Sciences here at the faculty. Our Dean is currently on a transatlantic flight, so he is not here, but we're all covered. We have, hopefully you've met some of our amazing students and amazing staff in the stalls. I'm just going to give you a heads up in a moment as to what's happening today for the program, but also what we'd like to do is just show you what our campus looks like and feels like when it's not raining and when you can get to see the mountain, right? Because we're right at the foot of the Hurikwaho Table Mountain. Go for it, thanks. So this is what we just celebrated our 110th year last year. And so we're the oldest medical school, health sciences faculty in the country. And here you can see imminently is what our faculty looks like. So you can see the Devil's Peak, or at the foot of Devil's Peak, so just around the corner from Upper Campus. And this will be the pathway that you will walk across the here. This is us all gathering on the lawn, which is where Shoko is currently today. We're gathering to count out our 110 years. And so that gives you just an idea as to what the campus looks like and what the views are like. So we really are close by here. So I'm going to give you a little rundown as to what you can expect today and then what you can expect at the health sciences faculty. So we've had, this is now the start of the second run of talks. We started at 10 o'clock this morning, and so I will be giving, together with my colleague from the Health Sciences Students' Council, the chairperson, Lutho Pikok, will be coming up shortly to join me. And then we will have talks flowing pretty much after each other from each of the programs that we run here, and we'll be ending at 3 o'clock this afternoon. Thanks. And so a map, just in case you have just joined, is that we're on the top right of this particular slide in the anatomy building, and there's a walkway across. You'll see the Shawco bus on the lawns, which you can visit, and then most of the programs have their displays. So MBCHB is currently in the laboratory outside the venue here, and our other programs are in the Barnard Fuller building, our health and rehabilitation sciences. Please do go and visit, and all our student societies are there, so please do visit. We've got 2 places where our admissions team are sharing information, and that's immediately outside here, but also in the Barnard Fuller building. So please do feel free. All information about funding, about residents, around all of those kinds of things are all on Upper Campus. And so you can experience the Jammy Shuttle and travel between the campuses, and they're running from outside the main building regularly up to Upper Campus. And then you get to experience what students experience, which is how the Jammy Shuttles work. So the other thing just to remind you is that all of the information that we're sharing with you today, so everything up on posters, everything in these talks will all be on the website. So if you go to health.uct.ac.za, on the open page at the moment, the landing page is the open day information. And all of these lectures today are being recorded, and they will be available again on the website during the course of the week. So all of that information is available there. So we would like to interact with you. If you've been in one of the other talks, you may already have this open, but particularly for those of you who are learners. So maybe the learners can put up their hands quickly. How many of you are learners versus parents in the room? Hi, come, we want to see you. Right, a whole bunch of you. Cool. So take out your devices, because no doubt you have come with them. Take out your devices, go to your browser and type in menti.com and put in the code, which is now for the afternoon, 15813139. So into your browser, menti.com, 15813139. And we're going to get to those questions in a moment. Don't stress if you haven't quite got the code yet. It'll come up again just now. So here at the faculty, our aim, we have 5 programs with a 6th coming up soon at undergraduate level. And so my talk is really to speak about the global space of all of those, and then each program will be spoken about in a moment. But really what we're looking to do here is to produce a generalist graduate, a generalist health professional who is capable of providing healthcare in our South African decentralized health system, which is a challenging space. And so those are students that need to be resilient and able to be change agents to make our society a better place to be for all of our citizens. Importantly, we want our graduates to be imbued with a spirit of inquiry. And what that means is that knowledge keeps changing, right? So when I trained, I sat in these chairs. They've been smartened up a little bit since my days. 30 years ago, I qualified. And so knowledge is completely different from when I qualified. So it's important that we don't get stuck on the actual content that we learn, but that we really learn to evaluate and understand and able to seek information, to be able to interrogate that information, understand what's good, what's rubbish, what's fake, and to be able to then understand and apply that in your practice. And then very importantly for our students and our graduates is that this is not just about walking out as a robot to be able to regurgitate what they've learned. It's really important that our graduates are leaving to be able to effectively change the world, right? So we're going to start with changing a patient, changing a community, changing a family, and hopefully at least change our country. And so it's really important and that we share the principles of equity and social justice as we teach our students. So we have, as I said, 6 programs. We have the we have 5 bachelor's programs. The first 4 are BScs in speech language pathology, audiology, occupational therapy, and physiotherapy. Each of those are 4-year programs. And so they are professional BScs, different to a BSc in the science faculty, which is a 3-year program. And so a 4-year program in a professional BSc is you're qualifying at the level of an honors program. So you can directly go into masters at that point, all right? So you don't need to do an honors after that. The MBCHB, Bachelor of Medicine and Bachelor of Surgery, is effectively 2 bachelor's programs put together. It's a 6-year program, and we'll go into that in a little bit more detail in a moment. And then importantly, we also have the 1-year higher certificate in disability practice. And this particular program is changing the way in which rehabilitation is being practiced, particularly in the Western Cape and hopefully in South Africa soon. So it's a really exciting opportunity. We also will be shifting our biokinetics program from a postgraduate program into a 4-year professional program over the next few years. So currently it is you start with a BSc and then do biokinetics as an honors. So back to your mentee. And what we'd like you to do is to type in 1581 3139. And let's see if I can get my my colleague who has dipped out for a moment to just get there. Right. So here we go. All right, let's get there. Okay, so you should be here. So which health profession are you interested in? So let's get a sense, and I'll tell you a little bit. Right, no surprises that a whole bunch of you are interested in medicine. And I'm delighted to see that a number of you are interested in physio and OT, some speech language and audio, and a couple of you are unsure. And that's perfectly okay. That's why you come to today, right? To come and learn and understand and figure out. So these kinds of ratios are also similar. We have 250 spaces available in medicine. We have 70 spaces available in physiotherapy and 70 in occupational therapy. And we have 40 available in speech language pathology and in audiology. So we have 25 to 30 available in disability studies. So we get 25,000 applicants a year for 450 places. So no doubt you wouldn't be sitting here if you weren't doing maths, right? Because all of these programs require maths. So I'm sure you can do the maths. 450 out of 25,000 is that we are only able to offer 0.2% of the applicants a place in health sciences faculty. Of those 25,000, at least 8 to 10,000 meet the minimum entry criteria. So they are eligible. We can't take in 8,000 people. We only have space for 450. And the reason we have space for 450 is, one is capacity on the clinical platform, but two is because that's what we're accredited for in Health Professions Council. So these places are at a premium, but it does mean that we that things are very competitive, and we can talk about. So when you're listening to the other talks about minimum entry criteria, you need to be doing a lot better than those to be getting in. So let's hear about how much you know about these, because certainly for those of you, we know that Grey's Anatomy et al. Don't tend to focus on doctors, right? But they're not necessarily focusing on occupational therapists, physiotherapists, and all of the therapy team are required for adequate treatment of a patient. And so many of these are certainly required. Right, so those of you, hopefully your knowledge about that you have researched and know about is not just on Grey's Anatomy, and that you know. But I can see that for many of you, that actually you don't know a lot about the other professions. And so it would be really important to use the opportunity of today to listen to the talks, but also to go to the stalls and talk about what those opportunities are. Most people really just don't have a good idea, and so aren't able to engage with that as a possible profession. And so we really encourage you to listen to the talks and to move beyond that. All right, so now, without my colleague on board, I'm just going to try and find my way back to my session. Right. Okay, so as I indicated, these are 4-year professional qualifications that require 1 year of community service, followed by registration with Health Professions Council of South Africa. We can only practice as health professionals by being registered. In fact, our students register from year 1 already, so they're already bound by the ethical code of conduct of the Health Professions Council as students already. For MBCHB, it's a 6-year professional qualification with a 2-year internship followed by a year of community service. And through all of that, you register in those categories, but it's only after 5 years as a OT, physio, audiologist, speech language pathologist that you can practice independently, and after 9 years that you can practice independently for medicine. Disability studies is 1 year, and you are able to practice immediately. All of our courses, so this is a big difference between us and other programs at other universities, is that all of our students are learning together in an interprofessional way in year 1 already. And this course, Becoming a Professional, Becoming a Health Professional, really starts to speak to some of those attributes. So what's really important, and that we remind our students about, and particularly as students come in, they're really only focusing about, we want to feel like an OT or a physio or a doctor. And the challenge, of course, with that is that that some of that we need to, there's some knowledge that comes early on and foundations that we need to lay, but also it's not just about knowledge. It's also not just about skills, about teaching you to dissect, to take a blood pressure, to manipulate a joint. It's also about understanding about who you are as a person, as a professional. And so what's really important are these aspects around more than knowledge, more than skills, about being a communicator, being a collaborator, being a leader and a manager, being an advocate for your patients. Our clinical training sites are across the peninsula. So students will come onto this campus for their early years, but we'll start quite quickly moving into the clinical platform. And our clinical platform is spread right across the peninsula, at hospitals, at clinics, at NGOs, at schools. And so they're placed effectively in workplaces which would be similar to where they would be working after qualification. Similarly, we have rural clinical training sites across the Western Cape. So we also train in Vredenburg, George, Knysna, Oudtshoorn, Mossel Bay, and many of the clinics, smaller clinics in towns around those. We have incredible innovative teaching and learning, as well as amazing teachers, both the silent teachers and the alive teachers. So our silent teachers are our cadavers, our donated persons who have donated their bodies for science. We also have amazing state-of-the-art facilities. This is our biomedical engineering division that looks at a range of incredible work in the faculty. But what's really important across our health professions is the human touch and human connection. That's really why we go into the professions that we do, is that we are wanting to make a difference for individual patients and for communities. And so we're really looking to make sure that students access and are able to engage in that human touch and human connection. I'm now going to hand over to my colleague, Lutho Pikok, who is the chairperson of the Health Science Students' Council, and he's going to take us through a little bit about the experience of being a student.
Thank you, thank you. Thank you, thank you. That was the wonderful Deputy Dean of our faculty. Very kind and outspoken. My name is Lutho, as introduced. My name is Lutho Pikok. I'm a third-year medical student here at UCT, and I'm also the chairperson of the Health Science Student Council. Health Science Student Council is a council consisting of health science students. It's the highest decision-making student body on our campus. Consists of 10 of us, who are all democratically elected into this position. We ensure that we are the student voice, that each and every student that comes within these premises graduates and is comfortable on our campus as well. So on our campus, we have societies. Shoko being the biggest society. So Shoko within itself has various departments which cater for audiology students, physiotherapy students, speech and therapy, physiotherapy, and medicine. Alongside Shoko, we also have surgical society, a society that enhances medical students or students per se, surgical skills. We also have the African Research Society, which also caters for students that are much more interested in research. We have other societies like UCASA, which is specifically for OT students. There are many societies, I believe all of them would stay here the whole day. So in terms of joining these societies, so these societies, you join them during Plaza Day or during the year, you become a member of these societies. Social life. We often get this misconception that health science students don't have a social life. It's not entirely true. So we do have a social life, we do have outings. We are centrally placed, and that's the best thing. We're closer to the beach, closer to the shopping malls, closer to places of where you can do activities and have fun with your friends. Majority, actually most of the restaurants around as well. So you can just enjoy yourself as a health science student as well. It's a very diverse campus. You can meet anyone, like anyone. I mean anyone. It's unlike high school where you are constricted to just people who live in your community or in your province whatsoever. You meet different people from different provinces, different countries, possibly. In terms of support, we have a great support structure, I'd say, as an institution, UCT, and as a faculty itself. We have student wellness services. Student wellness services are free to every student that is a UCT student. So if you have problems, whether it's your mental health or you're not coping, I mean, moving from high school into varsity, it's a huge adjustment. So you will need help and reach out if you need help. We have the faculty student development and service support services, which are specifically for us outside students. So what they do also is they deal with personal adjustment issues, identity issues, financial emergency financial support, and family bereavement. Because along this journey, some of you are going to be here for 4 years, 6 years. Cycle of life, unfortunately, we are going to lose members, and it's going to take you off track in terms of their schoolwork, but the support is there. for students who face such matters in our faculty. And our mentorship program, we have a very great mentorship program. These are well-trained mentors. So each and every student that comes into our faculty first year has a mentor that's assigned to them. That mentor is going to be doing the same degree that they are doing. So it enhances the aim of you knowing that the person that's mentoring you has already walked the journey that you are already walking on. So this is a beautiful team of mentors. They're well trained, dedicated. And then for Raise Life, UCT raises accommodate 8,400 students. First years get priority, in terms of placement in these UCT raises. So we also have the Jammies blue shuttles. I'm sure you've seen them around. UCT shuttles, they are free. They can take you anywhere. They go as far as Cape Town CBD and Clement over there. And also take you in between campuses, upper campus, middle campus, and so on. You move around. They also go to various residences. So you don't have to stress whether will I get in time to class or how will I get to class, because those services are offered to you. Our residences also have study spaces, mini study spaces. Our faculty is also filled with an ample of study spaces. Residences have tutors as well. So if you yourself are struggling in terms of a subject or course, there are tutors in your residence that will help you there. There are also resident-specific mentors that will just show you around the res and help you adapt to your new home. Leadership positions such as house committees, sub-wardens, and the rest. So you get a chance to enhance your leadership skills and learn to work in teams. As health science students, you are going to work with other people in other disciplines. That will help you in future. And yes, thank you. If you have any questions for me, I'll be outside for 5 minutes. Yeah, thank you for being here.
So colleagues, just with the changeover of time just before this slot, we're now on time for the next talk. So for any specific questions, Lutho and I will be outside in the foyer. But right now we're going to move on to disability studies. And we have our amazing staff and students who are going to be sharing that. And then we will move on to OT and physio.